Hi, my name is Christine Thompson, and I chose to do my interview for a patient with multiple sclerosis for the issues in women's health care. Multiple sclerosis is an autoimmune disease of the brain and spinal cord. It affects women 2 to 3 more times more than men. It has the potential to be debilitating. Um, it's not visible from the outside, so someone could have multiple sclerosis and you would never know that unless they ended up having a flare-up. Flare-ups can happen overnight, and with no reason for them to happen. With multiple sclerosis being an autoimmune disease, this means that the immune system attacks parts of the body. In this case, it attacks the myelin sheaths, and that's the fatty covering that's on the nerve. When it does this, this causes communication problems between the brain and body, and it depends on where um, the damage is, what part of the body will be affected. They can get numbness of the feet and legs, difficulty with balancing, muscle weakness in different parts of different muscles, muscle spasticity, and then sometimes difficulty with vision. Um, they can also have difficulty with the bladder. Um, so that to diagnose the multiple sclerosis is kind of difficult because the symptoms of multiple sclerosis is sometimes the same as other nerve disorders. So there's more than one test. A detailed medical history will be taken. They do blood tests, MRI. They do something called a coordination and balance test. They also test the fluid around the brain and spinal cord called cerebral spinal fluid. And they also do a test which is called evoked potentials test. That test checks the electrical activity in the brain. The risk factors for multiple sclerosis, like I said before, the women are 2 to 3 times more likely than men. If you have a family history, there's a potential for you to develop the multiple sclerosis. Also, there's a link between Epstein-Barr virus, having that, and getting multiple sclerosis, and then are developing multiple sclerosis. And then types of autoimmune disease that could sometimes, people who have thyroid disease or type 1 diabetes or inflammatory bowel disease have a greater risk factor of developing MS. Race, it's found that white people of Northern European descent are at a higher risk, and also people who are from temperate climates, including Canada, Northern United States, Southern Australia, and Europe, are more likely to develop MS. MS has no cure. They have disease-modifying medications, so they have some pills that people can take. They also have injections. Physical therapy sometimes helps, and then yoga, tai chi, massage and acupuncture. Swimming helps, and then sometimes meditation. The person that I interviewed was a friend of mine from work. She was diagnosed in April 2000 when she was 42. Her predominant problem that she has is with her bladder. Her brain doesn't tell her bladder when it's full. So she's had to self-cath for the last 12 years. The current treatment that she is on is Copaxone, and that's a sub-Q daily. She has no side effects with this. Before that, she was on Avonex, and that was intramuscular weekly, and that gave her flu-like symptoms, so then they switched it. So besides her bladder problems, or along with her bladder problems, she has developed nocturia, and she takes so she uses a nasal spray called Noctiva to help treat that. The other thing that she says happens is when she gets fatigued, it feels like she's hit a brick wall, and no amount of nap or sleep will help with that. And there are many times that she has had to cancel plans because she was too exhausted to do anything. And sometimes people didn't understand because they don't know that she has MS. Sometimes the heat worsens her symptoms, so she keeps like ice packs, or she did have an ice vest at one point in time that would try to help prevent flares. She did have at one point in time problems with her insurance paying for the preventative treatment. They just wanted to pay for flare-ups that came up, and so her physician had to write many letters to try to get that corrected. She has a great support of family and friends. She's the team leader of her MS support group, and then she's the team captain of, she does the MS walk every year, and she's the team captain for that. The activities that help her are physical therapy. She enjoys the deep tissue massages, and then swimming. She said if she can find a pool that's cool enough, because, like I said, the heat can cause the flare-ups or make whatever she's having worse. She said that MS has taught her to prioritize her days, and then when she's having good days, to reserve her strength. The provider that I chose to interview is a nurse practitioner with WellSpan Neurology in Chambersburg. She has 10 MS patients, 5 of which are women. She said that her biggest challenge is with patients not understanding that MS affects everyone differently, and while someone else can have the same symptoms, they may not have the same, their symptoms may not go away the same as somebody else's. She said the disease-modifying drugs work well for both men and women, and since this disease affects mostly women, the drug research takes that into account. So the research is geared toward women. And the one thing she did say was exacerbations can strike out of nowhere. She has a friend that has MS, and one time she may be fine and walking with a walker, and then she gets overheated and tired and end up in her wheelchair. So in conclusion, MS is a debilitating neurologic disease with no cure. Flare-ups can happen at any time and cause social problems with the people who are affected and their loved ones and friends. And every patient is different, and the symptoms and disease progression. And that is it, and my references are there. So thank you very much for listening.